ready, you let me know.
Okay.
Okay, so gentlemen, this is our demonstration of the first 8 stages. With me here, it's a big valve mask. So on this one, if you look at these ones, they are 2 different. This is a small one. This one is a big one. So this one we use it for small kids. So children mostly, so that we avoid what? Hyperventilation. So the bag takes little air also to the patient, so especially kids, so that we avoid too much air, you get it, which is hyperventilation. Then this one, we use it for adults. So, how it works, this one, if you want to connect it to the oxygen supply unit, then it can work about 90 and above percent. But if it is connected to, if you are taking air from the atmosphere, remember I said we are taking about 21% to 22% of oxygen to the patient, which is more than enough than when we were doing our what? Mouth-to-mouth ventilation. All right, so with the stages as it is displayed on the board, stage number 1, we say that you can be called as a first aider. Please, there is emergency, come to the scene. So you have to wash your hands, wear your gloves properly, make sure that your gloves fit properly, take your first aid box, attach to the scene. When you get to the scene, before you get straight to the scene, at a distance you check for any hazard. You identify if there are any hazards, remove them away from the casualty, so that the casualty is free from hazards. So that is why we identify hazards. If we find that the hazards are difficult to control, then you as a first aider, you cannot proceed because you can become a victim. So you have to stay away up until the hazard is fully controlled. Then now, when the hazard is fully controlled, we get to the patient. Hello, I'm telling the first aider from Jericho, may I help you? Hello, can you hear me? Hello? So we are just trying to determine the level of consciousness. If the person is conscious, he's gonna respond. But if he's quiet like this, he's not responding, it means that he is unconscious. So quickly, I will call someone. Can you please call the ambulance? So in my first aid box, there is an instruction on how to call the ambulance. So definitely introduce yourself. Tell them exactly where you are, or what is the problem with the victim. Is it an injury, fracture, is it burns, is it any illness? So report to tell them, the paramedics, exactly what is happening. Then when that is done, make sure that you recall the name of the paramedic or the person who answered your call, so that you can be able to do a follow-up. Then make sure that you don't hang up your phone. They might need more information. So give them the physical identification of the area. So while the ambulance is on its way, you now have to go to the next stage, which is the primer survey. So with the primer survey, it's airway. So what we do with the airway, head tilt and chin lift. Finger sweeping in the mouth to check if there are no foreign objects. In the nose to check if there are no foreign objects. Just do your assessment. So if you see that there are no objects, the airway is not blocked, then you proceed to B. You look, listen and feel. So I'm feeling and listening for any signs of breathing, looking at the chest rise if the patient is breathing. So looking at this, I can see that there is no breathing. So if there is no breathing, I have to resuscitate. So I have just to check if there is pulse, because it might happen that there is no breathing and pulse, so that I can do CPR at once. So I can just feel for pulse, or no pulse. So in this regard, I have to perform CPR. So CPR, we take our big valve mask, make sure that it's sealed, like this way. You seal it so that there is no air escape. Tilt, then press. If you look at this, there is air getting in. 1, 2. After 2, 1, 2, 3, 4. At the center of the chest. So we look at the sternum bone, lock, Hip straight. 1, 2, 3, 5, 6, 7, 8, 9, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. And repeat again. Look, listen, and feel. Still no breathing. Still no pause. Tilt, shift. 1, 2, 4, in. 9, 10, 11, 12, 13, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 28, 29, 30. So you continue. So this you have to do 2 artificial ventilation, 30 chest compression on a cycle of 5 per 2 minutes. Then we continue doing that up until the patient regained consciousness. When the patient regains consciousness, then that's when you can turn on to secondary survey. So on secondary survey, it means now you are do further assessment, checking the signs and symptoms, any allergies, any medication, past medical history, last meal if the patient has eaten anything in the last 30 minutes, oral intake, checking for the event, what led to the situation. Then when you are doing such assessments, you'll be talking to the patient, determine the level of consciousness. So you check the alertness, you listen to the voice, pain and unresponsive. Then you also have to now check breathing and record